We're going to talk about electrolyte and acid-base disturbance in patients with diabetes mellitus. Right. So the definition is electrolyte disturbance are common in patients with diabetes and may be the result of an altered distribution of electrolytes related to hyperglycemia induced to osmotic fluid shifts or total body deficits brought about by osmotic diuresis. Complications from end organ injury and the therapies used in the management of diabetes may also contribute to electrolyte disturbance. Sodium increases plasma glucose concentration, can lead to changes in plasma sodium concentration through several mechanisms. Elevations in glucose concentration increase plasma tonicity, creating an osmotic driving force that favors the movement of water from the intracellular space to the extracellular space, thereby diluting the extracellular concentration of sodium. The plasma sodium concentration is usually low as a result of the osmotic flux of water. Increased or normal plasma sodium concentration in the presence of hyperglycemia indicate a clinically significant deficit in total body water. Certain medications that are prescribed for the management of diabetes are also associated with hyponatremia. The treatment. The simulation of hemodynamics with normal saline is the initial goal of fluid therapy in patients with a hyperglycemic crisis. During the courses of care, a switch to more hypotonic fluids may be required for patients in whom a deficit in total water has been determined. Isotonic saline infusion should be continued when the corrected plasma sodium concentration is reduced. Potassium. Insulin deficiency, which is more common in type 1 diabetes than in type 2 diabetes, is an important factor in the net efflux of potassium from the cell. In patients with type 2 diabetes, the insulin-mediated uptake of glucose is impaired, by the cellular uptake of potassium remains normal, a situation that is consistent with the divergence of intracellular pathways that follow activation of the insulin receptor. Hyperkalemia can be caused by an increase in plasma tonicity that results from the redistribution of potassium from the intracellular space to the extracellular space. The efflux of potassium from the cell is due to intracellular dehydration, which results from the osmotically induced transcellular movement of water. This movement creates a favorable gradient for efflux of the potassium. Acid-base disturbance. Diabetic ketoacidosis is characterized by the accumulation of acetoacetic acid, beta-hydroxybutyric acid. Ketoacidosis results when the rate at which hepatic acetic acid is generated exceeds peripheral utilization, and the concentration of cetoacid in the blood increases. The accumulation of protons in the extracellular fluid causes the discomposition of bicarbonates to carbon dioxide and water, whereas the concentration of cetoacidosis anions increases. Reductions in plasma concentration of bicarbonate initially approximate increases in the anion gap. Hyperkalemic renal tubercle acidosis is a common condition among patients with diabetes and overweight neuropathy. The disease is characterized by disturbance in the nephron function, which leads to impaired renal excretion of hydroxygen and potassium and result in hyperkalemia and hyperkalemic normal gap acidosis.